Assalamualaikum to everyone. My name is Nur Zamzurain binti Zainal from class 2, and today I would like to present about HIV/AIDS disease with my teammates. I will start with the definition of HIV and AIDS and the total cases recorded in Malaysia. HIV, or human immunodeficiency virus, is a virus that attacks cells which help the body fight infection, making a person more vulnerable to other infection and disease. It is spread by contact with certain bodily fluids of a person with HIV, most commonly during unprotected sex, for example, sex without a condom, or through sharing injection drug equipment. If left untreated, HIV can lead to the disease AIDS. The human body cannot get rid of HIV and no effective HIV cure exists. So once you have HIV, you have it for life. AIDS is the late stage of HIV infection that occurs when the body's immune system is badly damaged because of the virus. Without HIV medicine, people with AIDS typically survive about 3 years. Once someone has a dangerous opportunistic illness, life expectancy without treatment falls to about 1 year. HIV medicine can still help people at this stage of HIV infection, and it can even be life-saving. But people who start ART soon after they get HIV will experience more benefits. That's why HIV testing is so important.
The virus that causes HIV is known as the Epstein-Barr virus. It may spread by sexual activity, the use of illegal injectable drugs, sharing needles, coming into touch with infected blood, or mother-to-child transmission during the pregnancy, childbirth, or also nursing. The white blood cell called CD4 T cells, which help your body to fight the infection, are damaged by HIV. As your CD4 T cell count declines, your immune system gets weakened. Before developing into AIDS, the HIV infection can last for years with little to no symptoms. You can identify as having AIDS when your CD4 T cell count falls below 200, or you experience an AIDS-specific consequences, such as an infection or cancer.
According to Global AIDS Monitoring Report by Ministry of Health Malaysia, at the end of year 2020, there were estimated 92,063 people live with HIV in Malaysia, and 80,428 of whom were aware of their status and had been notified through the National Surveillance System. By December 2020, 58% of the reported people live with HIV were receiving antiretroviral treatment, or we call as ART. More than half of new HIV cases were notified from populous states such as Selangor, Federal Territory of Kuala Lumpur, and Penang. Next, we move to the objective of this case study. Firstly, the objective of this case study is to define the meaning of HIV/AIDS. Secondly, to identify some effective ways to prevent HIV/AIDS. Thirdly, to analyze the suitable treatments. Fourthly, to study the symptoms of this disease. Next, to list out people who can be infected with HIV/AIDS. And lastly, to learn the causes of this disease.
Sexual activity is one way that HIV can spread, through vaginal, anal or oral sex with an infected partner whose blood, sperm or vaginal fluids enter your body. You could get the infection. The virus can enter your body through mouth sores or microscopic tears that develop in the rectum or vagina during sexual activity. In addition, you can contract the disease by, say, sharing needles. You run a high risk of contracting HIV and other infectious disease like hepatitis if you share infected injectable drug paraphernalia, the needle and syringe. In some instances, blood transfusion can propagate the infection. Hospital and blood banks test the blood supply for HIV in the United States and also other upper middle income countries. Thus, the risk is relatively low there, because they are unable to inspect all donated blood. The low-income nation may be in a greater danger.
Assalamualaikum and hi to my respective lecturer and my fellow classmates. My name is Nur Emilia Shazrin binti Muhammad Zain and my student ID is 2020839578. Today, I will explain my part about what is the symptoms of HIV or AIDS. First of all, we need to know that there are two phases of infection of HIV and AIDS. The first one is primary infection, also known as acute HIV. Some people infected by HIV develop a flu-like illness within 2 to 4 weeks after the virus enters the body. This illness, known as primary or acute HIV infection, may last for a few weeks. These symptoms can be so mild that you might not even notice them. However, the amount of virus in your bloodstream or viral load is quite high at this time. As a result, the infection spreads more easily during primary infection than during the next stage. The second phase of infection is clinical latent infection, also known as chronic HIV. In this stage of infection, HIV is still present in the body and in white blood cells. However, many people may not have any symptoms or infections during this time. This stage can last for many years if you are not receiving antiretroviral therapy. Some people develop more severe disease much sooner. So, as the virus continues to multiply and destroy your immune cells, the cells in your body that help fight off germs, you may develop mild infections or chronic signs and symptoms. When AIDS occurs, your immune system has been severely damaged. You will be more likely to develop diseases that wouldn't usually cause illness in a person with a healthy immune system. These are called opportunistic infections or opportunistic cancers. The signs and symptoms of some of these infections may include sweats, chills, recurring fever, chronic diarrhea, swollen limb glands, persistent white spots or unusual lesions on your tongue or in your mouth, persistent unexplained fatigue, weakness, weight loss, and skin rashes or bumps. That's all from me. Thank you.
Hi, my name is Nur Erina binti Abdul Muttalib. My student ID is 2020886834. I will continue this presentation with treatments for HIV. The treatment of HIV with medicines is called antiretroviral therapy. It is recommended for everyone who has HIV. The treatment of HIV with medicines is called antiretroviral therapy. It is recommended for everyone who has HIV. The medicines do not cure HIV infection, but they do make it a manageable chronic condition. They also reduce the risk of spreading the virus to others. There are several HIV medicines to reduce the amount of HIV in your body, which helps you by giving your immune system a chance to recover. Even though there is still some HIV in your body, your immune system should be strong enough to fight off infections and certain HIV-related cancers, reducing the risk that you will spread HIV to others. There are several different types of HIV medicines. Some work by blocking or changing enzymes that HIV needs to make a copy of itself. This prevents HIV from copying itself, which reduces the amount of HIV in the body. For example, nucleoside reverse transcriptase inhibitors, which is block an enzyme called reverse transcriptase. The second one is non-nucleoside reverse transcriptase inhibitors, which is bind to and later change reverse transcriptase. The last one is protease inhibitors, which is block an enzyme called protease. There are also some HIV medicines interferes with HIV's ability to infect CD4 immune system cells. For example, fusion inhibitors block HIV from entering the cells. The next one is CCR5 antagonists and post-attachment inhibitors blocks different molecules on the CD4 cells. To infect a cell, HIV has to bind to two types of molecules of the cell surface. Blocking either of these molecules prevents HIV from entering the cells. The third one is attachment inhibitors, which bind to a specific protein on the outer surface of HIV. This prevents HIV from entering the cell. To put it to conclusion, there are several prevention that we should take it seriously. The first one is get tested to HIV. Make sure you and your partner get tested to HIV before you have sex. The next one is condom usage. HIV is mainly spread by having anal or vaginal sex without a condom or without taking medicines to prevent or treat HIV. So make sure to use a condom before having sex and read the instructions to wear it correctly. The third one is limit your number of sexual partners. The more partners you have, the more likely you are to have a partner with fully controlled HIV or to have a partner with a sexually transmitted disease. Both of these factors can increase the risk of HIV. The last one is talk to your healthcare provider about pre-exposure prophylaxis or PrEP. PrEP is an HIV prevention option for people who do not have HIV but who are at a risk of getting HIV. PrEP involves taking a specific HIV medicine every day to reduce the risk of getting HIV through sex or injection drug use.